In wake of the recent shooting in Uvalde, Texas, the subject of mental health has once again come to the forefront. Today, I'm pleased to be joined by Eileen Panzarella, who is Director of Prevention Education at Pathway to Recovering Counseling and Education Services in downtown Hazleton. Eileen, thanks so much for joining me. Are people utilizing mental health services more than in the past? And are there enough services available to help everybody who needs it?
Well, I would definitely say more and more people are utilizing mental health services. I believe we're trying to work on the stigma that it's okay to not be okay. It's okay to reach out and get the help you need. So we are seeing, especially over this last year, a lot more people reaching out for services. Unfortunately, on the other side of that is there aren't enough services available for everybody who needs the help. There are waiting lists at most of the area agencies for mental health services. We just don't have enough people working in the field of mental health, and just not even enough numbers of agencies or private practices to go around for all the help that's needed.
I know a mental health problem can affect anyone at any age, but we're focusing, I guess, more on the teens in light of what happened in Uvalde. For parents or anyone watching this today, if they think there is a problem with their child, their grandchild, someone, what is your advice to them?
I would say, especially the later elementary, the teenage, the middle school, high school, you really want, ask them what they've heard about the situation. Ask them what they're feeling about the situation. And, really listen to them and understand and share your own feelings too. If you're feeling sad, you're feeling scared, let them know that it's okay to have these feelings after an event like this happens. You can also, share that these are rare events that do happen as well. And try to focus on the positive, look at who were the helpers, who were the heroes in the situation, and try to bring some of that positivity into this negative event that happened. But a lot of times the older, the teenagers, they want action. They want to do something as well. So you can maybe, look for solutions. Tell them maybe what you're doing. Are you reaching out to your representatives in the government about issues, more safety in schools? What can they maybe do? Maybe they can do some fundraising. Maybe they can send a letter to the other students at the school, letting them know that they're thinking about them, things like that. So look for some of the things that they can do, that you can both do together as well. You want to try to build resiliency, and that's what's going to happen if you do those things. But I think if you feel like that is not enough, maybe you want to talk to your pediatrician and say that this is affecting your child more, or the school guidance counselor, and see what they recommend. There's some services they could get at school, even though we're near the end of the school year. They might be able to access some services, or the guidance counselor can point them in the direction of what services are out in the community as well. And then if they think it's really an issue, they probably want to call one of those agencies and have their child speak to a professional then.
And while the investigation is still ongoing into the situation in Texas, oftentimes, there are signs that we learn about after an event like this. For someone watching, if maybe they've seen strange behavior on someone they know, whether it be a relative, a friend, what's the best way to handle that so that we don't have any more situations like in Texas?
Yeah, I think that's, we always hear about, they knew this or they knew that beforehand. And it is, unfortunately, we can't force a person to get help that might be needed, but making people aware that maybe can do something, like if it is the school, and letting people, people at the school know that you feel this child's depressed or this child's very angry and what might happen. And then, like I said, reaching out to the doctor, their general practitioner, and, letting them help direct where services can be.
Today's news feature is brought to you by Falvello Law Firm. Have you been injured in a car accident? Call Falvello Law Firm. Your case is our fight.